So this next little PowerPoint that we're going to do, we are going to go over the Montana POLST program, and we're going to help you understand it a little bit. This PowerPoint was developed by the Montana Board of Medical Examiners, and we'll use it to help you understand basically what a POLST is and how they work. This is a provider orientation program. So the program objectives are to explain the purpose and function of the POLST program to you, to help you understand considerations for how a physician actually issues POLST, to identify the differences between the old Comfort One and the new POLST, and to know where you can obtain forms and additional information about this. So advanced directives are instructions or communications from patients to their providers, okay? That's what they are, that's how they work. These instructions provide and identify the patient's future medical treatment decisions in the event they cannot make decisions on their own. Comfort measures are medical care undertaken with the primary goal of keeping a person comfortable rather than prolonging life. On the POLST form, an individual who requests comfort measures only would be transported to a facility only if it is required to provide comfort measures. Some of the things EMTs can do to help provide comfort measures might be oxygenation, might be suctioning, things like that. Durable power of attorney. This is a document that's signed by a person that appoints someone else to make healthcare decisions for them in the event the person loses the ability to make their own decisions. A living will is a common term for a healthcare directive. This is a document that tells your healthcare provider, if you experience a health condition defined in the document, what type of care you actually want. POLST, Provider's Orders for Life-Sustaining Treatment. It's a medical order from a provider that turns an individual's wishes for life-sustaining treatment into an action. Revocation. The definition of revocation is a procedure by which the patient cancels or revokes the POLST document to a medical provider. It may be revoked by verbal communication from the patient or individual with durable power of attorney, by destroying the form itself, or by not presenting it to healthcare providers. These are ways the forms can be revoked. Comfort One was the previous system that we had. It allowed EMT providers to follow the wishes of the patient when dealing with end-of-life issues. Comfort One documents are to be honored as they were in the past if presented. These have been phased out. There are 3 different things. There's the envelope you see here, the bracelet here, and then only the Montana Comfort One bracelet is valid, and then the form. But these are being phased out, and the POLST forms are the ones that are being utilized most. It's called Montana's Provider Orders for Life-Sustaining Treatment. The Board of Medical Examiners developed a protocol and a form for medical providers to be able to utilize to assure patients receive the care that they want. The form is intended to be completed in consultation with the patient, or if the patient is unable to speak for themselves, a family member. And then it is to be respected and followed by every healthcare professional that encounters this patient. The POLST form clearly identifies the wishes of the patient for resuscitation and the level of comfort care requested. The form's protocol and educational materials for the public and medical professionals are available on a dedicated website and can be accessed by going to polstmt.gov. This is the POLST form, and actually what I'm going to do now is I'm going to pause the video for a second and bring up the actual form as opposed to the PowerPoint. It's a little bit easier to read. Okay, so this is the actual PDF file of the form. As you can see here, it says HIPAA permits disclosure of POLST to other healthcare providers as necessary. This form must be signed by a physician, physician assistant, or advanced practice registered nurse in Section D for it to be valid. If any section is not complete, provide the most treatment included in that section. EMS, if questions or concerns, contact your medical control physician. As you can see here, this is where you put the patient's name, last name, first name, date of birth, and sex. In Section A, the first is treatment options regarding either attempt resuscitation with CPR or do not. Okay? So if the patient is not in cardiopulmonary arrest, that section is not going to apply, and we need to move on to other sections. In Section B, for treatment options, if the patient has a pulse or is breathing, Comfort measures only. We can relieve pain and suffering through the use of medication by any route, positioning, wound care, or other measures. We can use oxygen, suction, and manual treatment of airway obstruction as needed for comfort. We transfer patients only to the hospital if comfort needs cannot be met at the scene. Limited additional interventions. In addition to the care listed in comfort measures only, we can use medical treatment, IV fluids, and cardiac monitoring as indicated. We cannot intubate. We cannot use advanced airway interventions or mechanical interventions. We may consider use of a less invasive airway support such as CPAP or BiPAP. We transfer to the hospital if indicated for treatment or comfort. Generally, we avoid intensive care. Full treatment. In addition to the care described above, use intubation, advanced airway interventions, mechanical ventilation, and cardioversion as indicated. Transfer to a hospital if indicated. Include intensive care or any other instructions. Section C, artificially administered nutrition. Offer food and fluid by mouth if feasible or desired. No artificial nutrition. Define trial period, specifically for the period, and long-term artificial nutrition. This is tube feeding. Section D, discussed with the patient, the healthcare agent or decision maker, the court-appointed guardian, or other. So this is where the physician has to complete this. The patient or decision maker must sign. They must print their name and give the relationship if they are not the patient. The name of person preparing the form if it's other than the patient or the physician. The phone number of preparer and the date it was prepared. And then the physician, physician assistant, or advanced practice registered nurse or nurse practitioner must sign. And then print, date and time, and phone number. This form goes with the patient. Copies are okay. They're kept everywhere. We encourage use of the original form, but it can be photocopied, faxed, or electronic copies of the signed POLST forms are legal and valid. If you go here, this just tells you all about the directions for using the form. As you can see, any incomplete section implies full treatment for the section, so be sure that all sections are completed when you're helping somebody complete these forms if you do, and it may help you understand it as well. I will also put this document on the D2L website so you can review it. Now back to our PowerPoint. So these are all going through the sections. Some important things we need to remember. Now back to our PowerPoint. So these are all going through the sections. Some important things we need to remember. The POLST form and protocol helps assure that patients' wishes to have or limit specific medical treatments are respected near the end of life by all providers. When these forms are completed, they need to be printed. It must be readable to be valid. To be valid, the form must have a valid physician, nurse practitioner, or PA signature. The provider, when issuing, you should always consider diagnoses and consult with the patient, determination if the patient has advanced directives, consult with family to make sure that its wishes of the patient have been expressed to them, and determine the patient is in a terminal condition. Consult the end-of-life registry at endoflifemontana.gov and explain to the patient or family to make the completed POLST form clearly visible to medical providers. So we need to be able to see this. The provider should review the issued POLST when the patient comes into a facility for admission, anytime there's a change in their health status, and anytime the patient's treatment preferences change. Frequently asked questions. Does the POLST form need to be signed? Yes. If it is not signed, it's not valid. If the patient has a POLST form, do they need an advance directive? It's not required, but recommended that they have one. In what setting do we use POLST? It can be used in the home, transported by an ambulance, between care, regardless of whether they are in the hospital, at home, or in a long-term care facility. This gives us a one-form-fits-all standard. Where should it be kept? If the patient lives at home, the suggestion would be that the original POLST form is in a prominent location, say on the front of the refrigerator, on the back of the bedroom door, bedside table, or in the medicine cabinet. If they're in a long-term care facility, obviously it should be in their chart. If the patient has a Comfort 1, do they need a POLST? No. Comfort 1s are still honored. However, if they want anything beyond CPR, no CPR, they need a POLST. Any questions?